Sorry, team, the patient presents with myelitis, inflammation in various locations, and gastritis.
What are we thinking here?
Could it be multiple sclerosis with the inflammation patterns?
I'm leaning towards transverse myelitis given the symptoms.
I'm considering acute disseminated encephalomyelitis as a possibility.
I'm thinking maybe irritable bowel disease with the gastritis involved.
No. It's Gera's sclerosing osteomyelitis. We need to act fast. Discectomy is our only option here, even though it's risky. The benefits outweigh the risks. Start prepping for surgery. Tracy, thanks for calling me into your office. I really believe my patient has Gera's sclerosing osteomyelitis, and I want to perform a discectomy.
Hawks, hold on a minute. Are you sure about this diagnosis? We need to consider all possibilities before proceeding with such an invasive procedure.
Tracy, I have years of experience in this field. I know what I'm doing. Trust me on this.
I understand that, Hawks, but let's not forget your track record. You've been wrong before, and we can't afford to make any mistakes, especially with something as serious as this.
How dare you question my expertise? I have successfully treated countless patients in the past. I know what's best for my patient, and that is to perform the discectomy.
I'm not questioning your expertise, Hawks. I just want to make sure we're making the right decision for the patient. Let's take a step back and review all the options before moving forward.
Leslie, I just checked on the patient and it seems like he's in critical condition after the discectomy.
Oh no, that's not good. What do you think we should do next?
I think we need to inform Hawks that the discectomy was not the correct treatment for Gera's sclerosing osteomyelitis. He needs to know the situation.
But do you think that would make things worse for the patient? Shouldn't we focus on stabilizing him first?
I understand your concern, Leslie, but we can't keep this information from Hawks. He needs to be informed of the mistake made during the treatment.
I just can't help but worry about the patient's well-being. Let's make sure he gets the best care possible regardless of what Hawks might think.
You imbeciles. You nearly killed our patient with your incompetence, choosing the wrong dissectomy and misdiagnosing the issue.
But Dr. Hawks, we thought we made the right call based on the information we had.
I still believe we were on the right track with our diagnosis. It just didn't pan out this time.
Maybe we should have considered other procedures before jumping to conclusions.
I stand by my diagnosis. It was a calculated risk that unfortunately didn't work out.
You're all a disgrace to this profession. I can't believe I work with such a bunch of idiots. I'll handle this mess myself. You lot stay here and pray we haven't done irreversible damage. So, how's everything going outside the hospital, Johnson?
Oh, it's good. Just trying to balance work and family, you know.
Yeah, that can be tough. But I've been so consumed with this tricky case lately. It's been occupying all my thoughts.
You mean the one with the mysterious symptoms?
Exactly. And I think I just figured it out. I need to go check on the patient right away.
Wait, you're leaving now? What about lunch?
Sorry, Johnson. Duty calls. I'll catch up with you later. Sorry I'm late, but we need to change the diagnosis for Gera's case.
Hawks, where's your protective gear? You can't just barge in here like that.
Seriously, Hawks. The safety protocols are there for a reason.
Ignoring safety measures is reckless, even for you.
Listen to me. Gera doesn't have sclerosing osteomyelitis. It's hemimegalencephaly.
Anencephaly? What's the prognosis for that?
The prognosis is poor. It's a rare condition with severe developmental delays and epilepsy.
Are you sure about this, Hawks? It's a big call to change the diagnosis just like that.
I've never been more certain. We need to act fast for Gera's sake. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. What was the key to cracking it?
Honestly, it wouldn't have been such a mess if I didn't have a team of idiots working with me.
Wait, what do you mean by that? You were the one who gave the wrong diagnosis in the first place.
Well, my diagnostics team should have caught that mistake sooner.
Hawks, you can't blame others for your own errors.
I've had enough of this. I'm out of here.